this is side lying release, and so this can help, you know, open up the pelvis a little bit more. So you're going to be straight. I want to straighten your legs out. We want to make sure you're nice and stacked. And then I'm going to pull this leg up, forward, and then we're going to let it drop down and just let it hang. Just let it hang more towards the edge. And we're just letting it hang. We're just kind of stretching this. It's very simple. You can apply a little bit of pressure to the hip bone. And we just kind of stay here. You can even take this arm and stretch it out straight over you. Yep. And apply a little pressure. You can do cross pressure.
Okay.
Do you feel the stretch? Is it nice?
It is.
And so she can do this during pregnancy as often as you want.
Okay.
3 minutes on one side and then 3 minutes on the other side. You always want to do both sides because you want it to be even. The pelvis is supposed to be symmetrical. And this is a good position during labor too, to help the pelvis open up. Gives baby more room to come down. It's a temporary pelvic opening.
Feels nice.
It does feel nice. I love side lying. Super simple. It's a good relaxation. And even in this position, you could even let go of some of the pressure and you could do some lower back massage.
Okay.
A little bit of oil, whatever have you. And this is a good position to do lower back massage. When everything is all tight and just like achy, all the pressure. And look, she's like, You can do some arm massage, some light, gentle squeezes. You can do some hip rubs. It's nice and relaxing. Lift this leg, come back up, and then slowly over here, nice and straight first. Make sure we're nice and even. We lift this one up, we come out. We try to go for about 90-degree angle, but stretch to wherever you're comfortable. But yeah, try to keep that one straight. And arm over, do some cross pressure. Now you take her home, feed her, and have milk. So yeah, you can kind of do that. Good. And then you can sit up. I'll have you sit at the edge. Not really at the edge, but that's good. Do you have allergies to anything?
Animal dander. But I'm sure that's not relevant. That's not where anything like that, no.
So, lower back, tailbone press, and just put a little bit of whatever oil you like. And you don't have to be a massage therapist for this. You can literally go down and across. If you want to come and see what I'm doing, you can. Just kind of see, like, it generally starts right here.
Okay. Just go
And
down
then
and
down, and then just kind of around. And you can, like, you know, you can rub the hip areas and go in your pants a little.
It's okay.
But, like, you know, just this lower area tends to be really sore, especially, like, right here, right where the tailbone is. She's like, right where that tailbone is tends to get really, really achy and sore during pregnancy. And so it's very simple. Nothing, you know, my husband's like, well, I don't know what I'm doing. You don't really have to know what you're doing. It's just simple, a little gentle pressure. She'll tell you how, you know, and doing massage and little techniques together during pregnancy is good to help with communication during labor. So she can tell you, like, yeah, that feels great, or like, no, that's not comfortable, or that's too much pressure. And then you can kind of learn what type of pressure she likes and what areas feel good for her and what doesn't. And then it can be good for you to make sure that you're communicating with him.
Okay.
So it's a good little couples technique. But yeah, you don't have to do anything like, crazy. And then you're going to do the simple technique. It's the simplest thing ever, but it makes people want to go to sleep. So hand at the nape of the neck, and then
Okay.
and then on the forehead, and a gentle squeeze. Does that make you want to take a nap?
I'm about to.
It's like the simplest thing, but it feels so nice. It's let me do your arm real quick. So it's literally like about that much. Not a lot of pressure at all. Very like right at the back. So you see where my hand is, just like this. And then right at the forehead. And then push them both together. Gently.
Do you want to grab like the right behind the ear bones?
Yeah, kind of.
Okay.
Try it now. See if she says it feels similar to whatever I did. Just wait.
Mm-hmm.
Okay.
Good job, babe. That's nice. You're doing great, sweetie.
So very simple, and you can hold it for as long as she likes, or whatever. That's a type of technique that can be really good for a mom that has an epidural, and there's not much maybe she's not really having a lot of pain from the contractions or anything per se, but like she still needs some relaxation. The body's still tense, the body's still working hard. She's just not really feeling it, but afterwards she's gonna feel it.